Oh, hi guys. Welcome back to Dr. Gilead Show. Today, we're going to talk about personality disorders. Um, I want to welcome you again. We are on Facebook Live, Dr. Theo Oswala, MD, and also we are at WBGR Radio, and you can call on 301-429-9247. Today we're talking about personality disorders, and this is the beginning of a new series. And we're going to start with paranoid personality disorders. Paranoid personality disorders. Please, as we usually say, do not use what you hear on this platform to make a diagnosis of yourself or of anyone. Please do not treat yourself based on what you hear on this platform. It's always good to consult a trained doctor, a trained personnel to get the right diagnosis and treatment. Dr. Gilead Show, the producers, as well as the guests cannot be held responsible for what anybody does based on what they hear on this platform. All right, today we're talking about personality disorder, specifically paranoid personality disorder. Now, a personality disorder is described as an enduring pattern of inner experience and behavior that deviates, that is different from the norm of the individual's culture. A behavior that is completely different from the individual's culture. So, and this pattern is seen in the areas of cognition, the ability to think and remember things. Also, the area of affects, the way they relate to people, the way they react to mood, as well as their interrelationship or interpersonal functioning with other people or impulse control. So how they relate to people, how they do they act. And also it's known that this pattern of behavior is not flexible. They have a hard time adjusting to it. And it cuts across the board of different personnel and also of social situations. It can affect anybody in any group, any strata, any race. It is not race or gender specific. Now, the thing here is it also brings about significant distress, a lot of distress. Or also in impairment in social functioning at work or other areas of functioning as a human being. This pattern is stable, it's long, it's of long duration, and actually in the beginning it may be traced back to early adulthood or adolescence. So at a very early age or in adolescent period, as well as, or it may be traced to their old age. Now, personality disorders are classified into three groups: cluster A, cluster B, and cluster C. So we're going to start this series with cluster A. And in cluster A, you have the paranoid personality disorder, the schizoid personality disorder, and schizotypal. So today I'm going to take just the paranoid personality disorder, and this is the number one in cluster A. We all know of different people who have different behaviors, different personalities, and their actions when it comes to their relationship with people. So this is what we're going to talk about today: personality disorders, the paranoid type. Now, these people are always very suspicious. They're very suspicious of other people, and they always believe that other people's motives are bad and evil. So you have a spouse or a friend who he is very suspicious of you. He doesn't believe in anything you say. He's always thinking of a situation where you are out to harm him or outsmart him. So they believe that other people's motives are always bad and evil, so they don't trust nobody. Now, they always mistrust the motives of others, and they also believe that other people want to harm them or exploit them, and or deceive them, even in the most innocent situation where you really don't care about what is going on with them. You have good intentions, but in their heart of heart, in their belief, they think that you are out to outsmart them, out to harm them, or to deceive them. Now, they are always very reluctant to confide in people. They don't want to confide in people because they trust nobody. This is paranoid personality disorder. And these people, they bear a lot of grudges. They bear grudges against people for no clear reason. Now, they find a problem where even in the most innocent statements, you say something, oh, hey, your hair looks good. They think, what is he talking about? He's making fun of my hair. So even when you tell them something that is supposed to be nice, something that is supposed to be an acknowledgement of the good deed or how good they look, all they see is the opposite of it. Now, they are also very quick to feel angry and hostile towards other people. Paranoid personality disorder. We have all these people. We have people like this, people with this kind of characteristic in our families, in our place of work. They trust nobody. We have to be very, very cognizant of these behaviors and make sure that they do not affect our lives. And this is one of the reasons why we are talking about this personality disorder today, so people can learn, people can understand what what people with this disorder present with. It will help all of us to understand it so that we know how to manage them, we know how to relate with them at our place of work or even at homes. Now, while I want to say this, it is normal for everyone to have some degree of paranoia, some degree of feeling of suspiciousness at certain times. There is what is called healthy paranoia. Healthy paranoia. This helps you to protect yourself. Healthy paranoia is protective, and it helps us to understand where we are, how people are relating to us. This is important for us, for our survival. Healthy paranoia is necessary for our survival. Now, the people, so it helps, but what happens is people with paranoid personality disorder take it to the extreme. They take it to the next level. They feel that, hey, there's nothing good can come from anybody. You cannot acknowledge anything good about them. Now, this affects every relationship they have. When people have this type of disorder, it affects every relationship they have in their house, at work, even with themselves. Now, because of this behavior, people with paranoid personality disorder are so difficult to get along with. It's so hard to get along with them because they always suspect what anybody is saying, what anybody is doing. So it is hard to cope with them. It's hard to get along with them. They have a lot of problem with close family relations because they don't trust nobody. They sometimes it is hard to get into relationships, girlfriend, boyfriend, spouse, significant other relationship. It is hard for them to do that because they don't trust nobody. If you're going to get married, or if you're going to be in a relationship with somebody, you will have to You will have to trust the person. You will have to trust that somebody can come into your house and open the door and get in and cook and you will eat. That is relationship. And the people with paranoid personality disorder cannot trust anybody. Now, because they are so suspicious and hostile, they may become very argumentative. They argue a lot. They argue so much. And they complain a lot and they isolate. So they stay away from people. They ignore people. They stay away. They don't trust nobody. Now, because they are worried about threats from people, they may be overly guarded. They guard themselves. They can't open up. They're very secretive. They hide a lot of things. And they are distant from people. They're very distant from people, and they show no tender feelings towards other people. So how are you going to get in a relationship? That is why I'm talking about this today. So if you're dating someone and it looks like they don't care, they don't have any human sympathy or feeling or love towards you, and they're suspicious, you better watch it. People with paranoid personality disorder, they are very, very secretive and they isolate. Now, what happens is this. Their behavior, the behavior of people with paranoid personality disorder can elicit hostility from other people. So people become hostile because of their behavior. People become hostile towards them in response to the way they act. And what happens? They will see that as a confirmation of their expectation. Of course, they don't trust people. And when they look at the way people act towards them, which is a response to their behavior, they say, oh yes, you see, you don't care about me, you hate me, you're planning something against me. That is just a response to their actions. Now, also because they lack trust, they do everything they can to be self-sufficient because they don't want to go to nobody to ask for any help. So they try to guard and build up enough for themselves. They try to have good control over people around them. So they are in charge. So they are the people who they want to be in charge. They want to be on top. So they do not depend on nobody. So the people see them, they are isolated. What they say must happen. If they give you a job to do, they cannot trust that you will do it well. They think that you will cause a problem, or you will not, or you will sabotage it. So they micromanage people. These people are often rigid. They're critical of others, and they often have a lot of difficulty accepting criticism. So if you critique them for any reason, they are so upset. They can't take it because they are already suspicious that you are against them. They are already thinking that you are out to harm them, so they do not believe in anything you say. So the question is this. These people with these characteristics, what is it that could be the cause of paranoid personality disorder? Who knows? Your guess is as good as mine. Nobody knows the cause of paranoid personality disorder. But we have theories. It's all postulates. We can only theorize what could be the cause of this type of personality. Now, the most acceptable cause is what we call the biopsychosocial cause of paranoid personality disorder. And that means there's a biological component, which is the part that is genetically inherited. So if a parent has some amount of paranoid personality, the chances that one of the children could have it will also be there. Now, there is also the social factor. How a person interacts in their early development with family and friends, or even at the playground. So there is the genetic component of it, which is biological. There is a social component, which is how they grew up, how they developed, how were they relating with family members, how were they relating with friends at the playground, in school. That is another component of it. Then the psychological component is the personality and temperament, which is shared by the environment and learned coping skills. So how do they cope when they deal with stress? So you have the bio, psycho, social. So the biological, the genetic, the psychological, which is the personality and temperament, which they learn to cope with stressors. Then the social, which is the interaction with people, family members, and friends in school or playgrounds. So the personality, paranoid personality disorder is caused by a mixture of all three factors. And when a child develops, we need to look at what is it that affects their development. What is it that really shapes their future? What is it that shapes how they relate to others? I want to acknowledge Dr. Chigozie. He says, I'm interested in this topic today. So this is a doctor from Nigeria. Also, I see Dari, I see Benga, and Ralph. Thank you all for tuning in today. We're talking about paranoid personality disorder. So what is the prevalence of paranoid personality disorder? How common it is? How common is it? Now, it is known that paranoid personality disorder is more prevalent in males than in females. It is more prevalent in males than in females. And the ratio, in general population, it occurs between 2.3% to 4.4% in the general population. So it's something that affects a lot of people. 2.3% to 4.4% is a lot of statistics. So it affects quite a good number of people. So it's not something that we just overlook. So it's important that we pay a very good attention to this. All right. What are some of the symptoms? The Bible of Psychiatry, which is the DSM, the Diagnostic and Statistical Manual of Mental Illness, lists some statistic on paranoid personality disorder, and we know that these are the symptoms that the doctors will look out for in making the diagnosis. So the question is, what are those symptoms that your doctor will look out for? Now, number one is they suspect a lot without sufficient evidence that others are exploiting them. They also suspect that others are out to harm them and others are deceiving them. So they're very suspicious with no evidence at all that others are out to exploit them, they are out to harm them, or they are out to deceive them. That is number one symptom of paranoid personality disorder. That is number one. Number two, they are preoccupied with unjustified doubts about the loyalty and trustworthiness of friends and associates. So they are struggling with how other people are coping or are feeling about them. So they are so preoccupied with these feelings, which has no roots. There is no evidence to that. This doubt of loyalty or doubt about trustworthiness of friends and associates has no justification because the people have not done anything against them. Number three, People with paranoid personality disorder are reluctant to confide in others. Why? Why do they fear to confide in others? Because they are, because they have this unwarranted fear that the information will be used against them down the road. So they don't want to confide in anybody. We have people we trust. We have people we can say, hey brother, listen man, I got in trouble. I need help. They can't do that because they cannot confide in nobody, because they think the individual will tomorrow use that information against them in a very malicious way. Number 4 is they read hidden meaning or threatening meanings into harmless remarks or events. So you meet somebody or your spouse, your girlfriend, and you say, hey, yesterday the way you acted wasn't really nice. And what do? They read unnecessary meaning into it. And this affects their relationship with people. You make harmless remark. Oh, your tie looks so good. Or let me fix your tie. Your tie is it's a little crooked. Oh, they take it out of context. They read unnecessary meaning. They think you're demeaning about your dressing. They think that you are unnecessarily talking negatively about your dressing. Another symptom of paranoid personality disorder is that these people bear persistent grudges. So they persistently bear grudges. They are unforgiving of slight insults or even little slight statements or injuries. We walk by people and we step on their toes without even knowing. They take it seriously. They do not play with it. They bear the grudges, and they can bear it till thy kingdom come. They can bear it till they pass. This is one of those characteristics of people with paranoid personality disorder. They cannot joke. They can tolerate little little jokes, little slights, or little injuries. They bear grudges with you forever. Because of what you said yesterday, they do not ever, never want to talk to you again. So they bear grudges. They're very unforgiving. Now, they also perceive attacks on their character or reputation that are not apparent to others. So they think when you say something, they read meanings into it. They think you are attacking their character. They think that you are attacking their personality, but nobody sees that as anything. So you say a little word, you give a little explanation, they take it out of context completely. That is paranoid personality disorder. They take everything out of context. And because they think that their reputation is at stake, they don't joke with it. That is how people with paranoid personality disorder take things. They take it completely out of context. Also, they are quick to react angrily or counterattack, and they are very hostile. So for nothing, they react very angrily. They attack people for no reason. Why? Because they think that you have said something very, very demeaning to them, when actually you were just cracking a joke or just making fun that anybody would really enjoy or play with you. Now, so they have recurrent suspicions without justification regarding their spouse or sexual partner. So these are people, they go about, they accuse their spouse of infidelity. They think that their spouse is messing around. I had a patient who was so paranoid that he would put a recording device in the wife's car. So every phone call the wife makes while she's driving, It's recorded. Actually, I say at a point, there was a conversation the wife was having with somebody, and it wasn't too clear, but he brought the recording to me and he said, listen what he's talking. And that is a pastor. He kept talking about it, and he believed so much that his wife was having an affair with the pastor. Now, the issue here is they are so suspicious, and they think that their spouse or the significant other is having an affair. So they can go at any length to find out if it is true or not. Also, they believe that others have hidden motives and are out to harm them. So they trust nobody. They cannot take their food, keep it somewhere, and go to the bathroom and come back. No, they would rather take their food to the bathroom or sit back there under a lot of pressure to go pee, because they do not want anybody to look at their food or touch their food while they're gone. Also, they have doubts about the loyalty of other people. They don't think people are loyal to them. They're worried about the loyalty of people. They are also excessively sensitive to criticisms. They are so you say, hey, the way you typed this document, it looks wonderful, but it would have been better if you change this sentence to this. They can't take it. They are extra sensitive to criticisms. They can't take it. Now, they also have trouble working with other people. So, at a place of work, they are completely isolated, especially in places of work where you have people in cubicles and people work with computers. They may come into work, they don't talk to nobody, they sit down, they do their work. If they have anything, they email it to somebody, and they don't go to nobody to talk. They do not discuss with nobody. They are sitting at their desk all through. So they do not want to work with others. So what do? They take up jobs that they work at the back office where they don't have to interact with anybody. These people with paranoid personality disorder are completely detached. They're completely detached from people, and they socially isolate from people. They don't want to come, they don't want to interact with anybody. They don't go to parties. In certain jobs, Friday evenings, a group of workers can go do a evening outing on a Friday evening, but they will not. They don't go out, they don't interact with people, they isolate. They are so argumentative and defensive. So before you even say a thing, they become very defensive because they don't want to interact with you, they do not trust you. They also have problems seeing their own problems. They cannot see their own problems. They think that they are always right. So even if you point out that, hey man, listen, you are being unnecessarily argumentative, they don't want to hear it. They believe in themselves. They only trust in what they are doing. They don't care about what anybody else is saying. That is how people with paranoid personality disorder react. These people have a lot of trouble relaxing. They are always uptight. They cannot relax because they are suspicious of people. They can't relax themselves. They can't feel at home anywhere they go. So these are the symptoms according to the Diagnostic and Statistical Manual of Mental Illness, DSM-5. So if you have anybody who has similar symptoms, it's good to look out and appropriately direct them to get help. It's very, very important. So, what is the cause of this illness? Now, like most personality disorders, paranoid personality disorder we decrease in intensity as we grow older. So as we grow older, what happens is, at a certain time they would have realized that, wow, well, I've been suspicious of people, but nobody has really done anything to me. So as they grow older, they begin to loosen out a little bit. They begin to calm down a little bit because they are no longer as suspicious as they used to be. So as they grow older, they have fewer symptoms. So by the time they are in their 40s or 50s, they begin to lay their guards down a little bit. So that is the cause of the illness. But some people still feel a lot of paranoia up until old age. Sometimes, because I'm a geriatric psychiatrist, excuse me, I see quite a lot of people who still are paranoid to a very later age in their life. Now, how do you make a diagnosis of paranoid personality disorder? How do we make a diagnosis of paranoid personality disorder? This diagnosis is usually made by trained mental health care personnel, psychiatrists. A psychiatrist is a physician who's gone to medical school. He's a medical doctor, as a matter of fact, but he does a special training, a residency training in psychiatry. So he's a medical doctor who has gone to have more training in psychiatry. So such medical doctors as psychiatrists are properly trained to do this evaluation. Also, you have a psychologist who may have a PhD or a master's in psychology. They also can do this assessment. A lot of the times, your primary care physician is not trained to make this diagnosis, so they actually should refer you to a psychiatrist or a psychologist who can help out here. Now, the psychiatrist or the psychologist, as the case may be, depending on who your primary care refers you to, will perform what we call a comprehensive behavioral assessment, a comprehensive psychiatric evaluation. And this is done by asking different questions, and they will go through some of these symptoms we talked about, the different questions we talked about, and they will also look at your childhood, the relationship at home, how you behaved in school, and also relationship at work. How are you doing at work? How are the things? They may also ask you how you react or respond to some situations at your job or at home, or even some situations with your family member, with your significant other. Now, they will formulate a diagnosis, and I want to say clearly that to make a diagnosis of paranoid personality disorder, you don't need a laboratory evaluation. You don't need an X-ray. You do not need to get an MRI or CT scan. Neither do you need to get a genetic studies, and there are no blood tests to make such diagnosis. It is done by specialized psychiatric or psychological evaluation, and the diagnosis is all the time 99.99% correct. So that is how this diagnosis is made. Now, of course, many people with paranoid personality disorder do not seek treatment because they themselves do not believe they have a problem. They do not believe they have a problem. They may come to limelight when their coping mechanisms have been stretched. Sometimes people's coping mechanisms may be stretched so thin that they can no longer deal with stressors, or their coping mechanisms have failed them at work. I see people who come to me and they're talking about how they are maltreated at work, how people deny them of their rights at work, and you call the job, they say, no, there's nothing like that is going on. Now it becomes more difficult to manage or to tease out if it becomes a racial thing. A white person, a Caucasian, working with a boss that is black, or vice versa. People talk about how the boss is not treating them right. So this is a very big aspect of paranoid personality disorder. Now, they may present sometimes by themselves when it has affected them big time at their job. They're about to lose their work, or at home their wife or spouse is threatening to divorce them because they are hiding things, they do not trust their spouse, or they are constantly accusing their wife or their husband or their spouse or significant other of cheating, when actually the spouse or the significant other is not. They're home all the time, they're with them all the time. So they may now present for help because the significant other, the only person probably they have, is threatening to leave. So that is a lot of the times when they begin to seek help. I want to pause here and I want to recognize Prince Will from California, also Jacqueline from Washington, D.C., also Ralph from Nigeria, Mr. Koki from Nigeria, different people from all over the world. Thank you for tuning in. Today we're talking about paranoid personality disorder. Paranoid personality disorder. I also want to thank one of our sponsors, Paddock Healthcare Pharmacy. Paddock Healthcare Pharmacy is a family-owned pharmacy here in Bladensburg, Maryland. Their phone number is 301-277-7107, 301-277-7107. It's a family-owned pharmacy, and you can get all your medical supplies as well as your medications filled at this pharmacy. Thank you, Paddock, for being one of our sponsors. All right, paranoid personality disorder. How do we treat paranoid personality disorder? It is a very difficult illness to treat. The treatment of choice is actually psychotherapy. And psychotherapy is done by a psychotherapist. A psychotherapist could be a psychologist who does the therapy. Also, it could be a licensed clinical social worker. Also, some psychiatrists go through more extensive training in psychotherapy, and they carry out psychotherapy as well. Now, these psychotherapists or psychologists or psychiatrists or social workers who help with this illness are people that are specially trained, and they are experienced in treating personality disorders. It's not everybody that has the training. It's not everybody that has the expertise in treating paranoid personality disorder or personality disorders in general, because it is a very complicated illness. You see, it is a very difficult illness to treat. Psychotherapy for paranoid personality disorders involves a long-term treatment. It's not something that people get over in one day. Now, the type of therapy that may work is more of a supportive therapy, in which the therapy is client-centered or patient-centered, and that is the type of therapy where is centered around the individual that has a paranoid personality disorder. Now remember, this individual does not trust anybody. He does not trust you, the therapist. He does not trust his family member. He does not trust whatever you're going to say, because he's highly suspicious and he is worried that you may actually divulge everything he tells you. So he's very suspicious of you and anybody else. So it's a very difficult therapy to do. So you have to be ready to take it whichever way it comes. Sometimes they terminate therapy halfway because they actually develop very, very paranoid ideations towards the therapist, and they cut off the therapy. Now, because it is very difficult to build up rapport with these people, because they're paranoid, they do not trust anyone. So for you to be somebody's doctor or a therapist, the person has to trust you. There has to be a relationship. There has to be a doctor-patient relationship. And they are paranoid. They do not trust nobody. So the teaching or the advice for treating personnel, for physicians, psychiatrists, or psychologists, is to be straight up. Do not crack jokes. Do not say things that they may become, that may make them get suspicious and be worried that you may be planning evil against them. Now, also, it is no use arguing with the patient about the rationale for telling them that what they're thinking is not true. As a therapist or a treating doctor, you may look from a rational point of view that what they're saying or their belief is not true. What they're saying is not really the truth. But arguing with them to say, hey man, look, what you're thinking is not true, is useless. Because they have paranoia, they have false beliefs that no one can change. When people are paranoid, it is almost impossible to change that thought, to change that belief, because they don't trust nobody. Now, challenging their thoughts, challenging their beliefs, even though you know it's not real, will result in more frustration on both the part of the therapist as well as the patient too. Because you're there, sitting down, arguing with the patient, that, hey, listen, what you're saying is not true. But the patient is getting frustrated because he thinks that you're not understanding him. So you're frustrated, the patient is frustrated, therapy will not work. So what happens is, whatever they say is okay. Keep going, keep talking with them until they come to the point where they may trust you. That is really how it works. So you have to center your therapy around them. Now, sometimes they may have, we may have individuals that are so suspicious, or they decompensate and become very ill, they get agitated and they become aggressive. At that point, we may use antipsychotics. Otherwise, antipsychotics are contraindicated. You do not need to give antipsychotics because it will really do nothing. But if they are aggressive and they are very argumentative, suspicious, agitated, and it sounds or it looks like they may harm people or themselves, you may give a short course of antipsychotic. This will help to calm them down. Sometimes, because of their paranoia and untrustworthiness of people, what happens, they become very, very anxious. They have a lot of anxiety. So you can give a short course of anti-anxiety medication, whichever one you choose, from benzodiazepines, Valium, excuse me, or Prazolam or Ativan. Any of these will help calm their anxiety down, and they will feel better. They can cope with the situation. But they will always be suspicious. They will always be paranoid. It is not something that is going to go away. So the question is this: is it really worth treating this illness? Yes, it is. At some point, they may realize that this, what I'm thinking about, is not real. So what do? They kind of calm down a little bit when they've seen that, okay, I'm 40. I've always been suspicious that my father is planning evil against me. Or I've dated this girl for 10 years, 15 years, but I've always been suspicious that she will walk out on me, on this relationship, but they've not. They've stuck with me for 10, 15 years, so there's no need to be worried about them. They're going to stick it out with me. So they begin to lay their guards down a little bit. That is just one way. But what is it? What is the prognosis? What is the outcome? The prognosis for paranoid personality disorder is poor due to the nature of the disease. But everything that needs to be done must be done to help the individual. Whatever we can do to help them, we do it to help them. Because at some point, if nothing is done, they may actually become very problematic to themselves and to other people. So what is my advice as your treating psychiatrist? One, if you are that individual that you are feeling this way, you're very suspicious, you are always paranoid, thinking people are out to get you or harm you, you don't trust people, you isolate, it is always good to go get help. Go to a trained personnel, ask your primary care to refer you to a psychiatrist or a psychologist, a therapist who can manage your condition. If you're a family member, significant other, it's good to go get help because this is very important. Marriages are broken down because people don't trust their wives or their husbands. They think their husband is cheating on them, so go get help. So today we talked about paranoid personality disorders, and we're going to continue on this same topic on cluster A personality disorders next week. So please stay tuned next week, same time Thursday at 1 p.m. Eastern Standard Time, U.S. time, Eastern Standard Time. I want to acknowledge Kitty Flores, also Professor Hanuzwa from Owerri, Nigeria. Thank you all. Prince, Jacqueline, Ralph, thank you all for tuning in today. Please tune in again next week, Thursday at 1 p.m. Thank you, and enjoy your summer wherever you are. Stay cool because it's getting warm out there. Thank you very much. I see you again next week. Thank you very much for tuning in. Bye-bye.